Sahil's tutorial. Today our topic is too much interesting because it depends upon the baby's health. That is how to use the syringe bulb. Syringe bulb, we also call it as nasal aspirator. In some places it is also called as mucous sucker. It is a bulb like structure made mostly from the rubber material or silicone material, available at pharmacy store, hospitals, clinics or baby stores. Indication: when to use this one? We have to use when the baby nose is stuffy nose, first one, then boogie nose, second, then breathing from the mouth, which made baby feeding very difficult and irritable. How to use mucus sucker correctly or gently? Please don't use the excessive pressure. Hold the baby leaning back, okay, somewhat leaning back, little bit, head tilt. Instill 2 drops of normal saline each nostrils, okay, wait for 10 seconds, then compress the syringe bulb and keep it over the external nozzle and release gently. Then remove the syringe bulb and empty the collected secretion in the tissue. Okay, discard it. Alternately repeat the each nostrils as required. Cleaning syringe bulb with warm water before and after use each time. See, this is the tree diagram. Easy way to clean baby nose smoothly. Hold the baby slightly leaning back, means somewhat tilt. Instill 2 drop of normal saline each nostrils, okay, 2 drops in each nostrils, okay, and massage gently over the bridge of the nose, see, upside down, okay, like that. Then now compress the syringe bulb, remove the pressure syringe bulb and keep it on the external nozzle. See, this is the external, keep on the external nozzle and gently and release the pressure. It act like suction, suction pressure gently. Then whatever the collected secretions, take discard in the tissue, then use alternately, okay. Repeat the procedure as required. Note: always use gentle pressure. Rinse syringe bulb before and after use with warm water. Thank you.
Now the practical section started. See, you can see how I'm instilling the nasal saline drop in the each nostrils. Now I am massaging from bridge of the nose to upside down, so it make the mucus thick to thin and the dried secretions. The compressed mucus sucker should keep on the external nostril gently and release the pressure. Now whatever the content has came, it should be discarded on tissue paper. See, once again compress mucus sucker and keep just on the external nostril slightly gently. Please use firm pressure. Now whatever the content has been aspirated, that should, after each use, please wash with lukewarm water. Then make it dry and keep for further use. Once again I am requesting that please nasal aspirator or syringe bulb should be used by medical expert only. If you like my video to be knowledgeable, please do subscribe to my channel. Please like and share. Thank you.